Hello everyone, welcome to my YouTube channel Nursing Education. My name is Pinky and today I'm here with one of the interesting topic, that is assessment of the OSCE exam. So before moving further, if you have not subscribed to my channel, please consider subscribing it and press the bell icon to get more videos. Assessment station is a 20-minute station in the OSCE exam, and in the exam center you might have acted as a patient and you have to complete the APIE assessment as well as calculation of your scoring within the 20 minutes. And based on the disease condition of patient, you might have a different score to calculate. For example, if your patient is having respiratory condition or a pneumonia, then you have to calculate the NEWS scoring. If your patient is having a subdural hematoma, then you have to calculate the GCS score. If your patient is having depression and anxiety, then you have to calculate the PHQ-9 score and the NEWS score. And if your patient is at risk of malnutrition, then you have to calculate the MUST score and the NEWS score both. APIE is a mnemonic which helps you to remember what you have to do in the beginning of a station. So this can be used in all the stations except the silent station. So first is safe to approach. So when you enter into your station, you have to declare that scene is safe to approach. If you find some cigarette, good jug of water in case the patient is nailed by moth, in lighter or anything that you find this is not safe, then you have to use that things to in the communication and you have to remove, and then you have to make the scene safe before moving further. Then next is hand hygiene. You have to state all the 7 steps during the hand hygiene, and you have to use the ELIF 7 step of hand hygiene in the exam, and then you have to let it dry for 30 seconds after doing hand hygiene. Then introduce yourself and your role as a nurse. So you have to introduce yourself to the patient and your role as a nurse to the patient. Then preferred name they like to call by. So you have to ask the patient what they would like to call by or what they would like to address. Identity check. Identity check should be done in 3 ways. You have to see in the document of the patient. Then you have to ask with the patient about their name, date of birth and hospital number. And then you have to check the wristband of the patient. Allergy. You have to ask the patient about the allergy, whether the patient has allergy to any dog, any food, any peanut or anything. If the patient has allergy, then you have to check for the wristband, that is red wristband. If the patient has not got the red wristband and the patient is allergic to any drug, then you have to ask the patient, or you have to tell the patient that I will get the red wristband once I'll complete the assessment. Then you have to ask the patient about the latex allergy, and then you have to see the patient comfort, whether the patient is comfortable or the patient is having pain. If the patient is having pain, then you have to score the patient pain. You have to tell the patient that if the patient has to score 0 to 10, where the 0 is no pain and the 10 is worst pain ever, where would they score it? Then if the patient is having mild, moderate or any severe pain, then you have to tell the patient whether the patient can tolerate the pain until you will complete the assessment. And also you can tell the patient that I'll reposition the patient, and also you can ask the patient to do deep breathing exercise. And also you can tell the patient that after the assessment I will see in the medicine card if you have got any medication prescribed, then I'll give to you, or if not, then I'll ask the doctor to prescribe the one and then I will give you the painkiller. Before starting with the APIE assessment, you have to check all of this point. So you have to mention that the equipment has been calibrated and clean and ready to use. Then you have to maintain the privacy. You have to verbalize the shutting the curtain or door, and you have to ask the patient if patient has been rested for last 20 minutes, not had hot or cold drinks in the last 5 minutes, and ensure legs are uncrossed as it can affect the blood pressure. And also you have to ask the patient that whether the patient want to go to the toilet, because all the assessment will take a 20 minutes and the patient may want to go to the toilet. But in a OSCE exam they are not going anywhere, but still you have to ask to the patient. A2E assessment: airway, breathing, circulation, disability and exposure. So these 5 components you have to perform in the exam, and then make sure that you have practiced well so that you will not leave any point to do in the exam. So in the A2E assessment, airway is first. So you have to ask the patient to take a deep breath, and you have to state that as the patient can take deep breath and patient can speak 4 sentences, so the airway is clear and there is no visual obstruction. So second is breathing. So in the breathing you have to check for the respiratory rate. So as you know that when you check for the respiratory rate in the patient and the patient is aware about it, there might be different in the rate or there might be alter the rate. So in the OSCE exam what you have to do is you have to check the pulse rate and respiratory rate together, and you have to tell the patient that I'm going to check your pulse rate for the 2 minutes, and in that 2 minutes you have to check the pulse rate and respiratory rate both. And after checking that, you have to tell the patient that I have checked for your pulse rate as well as the respiratory rate, and I did not tell you because it might alter the rate of the respiratory. And then you have to tell the respiratory rate and the rhythm, whether it was regular or irregular, and the depth, whether it was shallow or normal. Then you have to check the oxygen saturation level. So before putting the prop of saturation, you have to check for the false nail, nail polish, varnish nail, and any injury, and also the capillary refill. So for the capillary refill, you have to press the fingernail for 5 seconds and release it and check the whether the blood came back within 2 seconds. Then you have to check for the respiratory noises, whether the respiratory noises are present, like rattle, wheezes, stridor or coughing, and you have to state it. Then you have to check for the equal air entry in the chest of the patient. So you have to place both hands on the chest of the patient after taking the consent, and you have to ask the patient to take breath in and out and feel the chest rise on the patient by your hand. And then you have to also see for the visual sign of respiratory distress, like use of accessory muscle, sweating, sinuses, and seesaw breathing. Circulation. In the circulation, you have to check for the heart rate, blood pressure, capillary refill, pallor, and perfusion. So heart rate you have to take with the respiratory rate, and you have to tell the heart rate, and then whether it was strong or weak, whether the heart rate was irregular and regular. Then you have to check the blood pressure. So before putting the blood pressure cuff, you have to see the hand, whether the hand is whether any inflammation or infection is present in the hand, whether the cannula is there or any IV fluid is going through the cannula. You have to check for the any trauma or any surgery has done in that hand or axilla, and you have to check for any previously brachial artery surgery or any edema is present in the hand. And then you have to check for the right size of the cuff of the blood pressure, and then you have to tell the bladder width of the cuff cover the 40% of the arm circumference, and the bladder length of the cuff cover the 80% of the upper arm circumference, and it is appropriate size for the patient. And then you have to check for the capillary refill. So if you have checked already during the saturation, then you have to state that I have already checked and the blood came back within the 2 seconds. Then for the pallor and perfusion, you have to place your both hand on the patient upper arm and the lower arm and feel the warmth of the arm. If it is warm, then you have to tell that patient is well perfused and also the capillary refill was normal. And then also you have to tell whether the patient has any pallor in the extremities or anywhere. So if your patient is having the subdural hematoma, you can complete GCSE score in the disability. So in disability, you have to see the conscious level of the patient using ACU-PU. So you can see whether the patient is alert, confused, or patient is responding with the voice or pain, or the patient is unresponsive. So in the OSCE exam, even the a patient is having a subdural hematoma, the GCS score will not be less than 13/50. And then you have to check for the presence of pain, whether the patient is having pain, and check for the urine output, whether the patient is having any difficulty in passing urine. And then you have to ask the patient whether someone has checked the blood glucose today. If have checked, then you can ask the blood glucose level with the examiner, and they will tell whether the patient is having the blood glucose level within a normal or the abnormal. Exposure, in the exposure you have to take and record the temperature, and then you have to ask the patient whether the patient is having bleeding, rashes, injury or bruises. You cannot expose the patient in the OSCE exam. You have to ask all those things to the patient. And then often a medical history. So what I advise you to do is first calculate your all the scoring, and then you do the medical history, because if you'll not complete or not calculate your scoring, then you will be automatically fail, and you will have limited time in the exam. So complete the scoring, and then you can ask all the history, because if you leave even taking some history, you will not fail, but if you not calculate the scoring, then will be fail in exam. So you have to accurately measure and document the patient vital sign, and then you have to put in the specific assessment chart all the vital sign. Then you have to calculate the NEWS score or the Glasgow Coma scale based on the patient condition, any one of you can get. And then you have to conduct a holistic assessment relevant to the patient scenario. Thank you for watching. Please like my video and subscribe to my channel and press the bell icon to get more video. Keep watching, keep supporting. Thank you.